Hello guys. Welcome back to Tablet Talk. Today, we're diving into pantoprazole, a medication that you'll often come across when dealing with stomach issues. So, what is pantoprazole? Well, it's a proton pump inhibitor, or PPI for short, and it's super important for managing conditions that involve too much stomach acid. This includes everything from heartburn to ulcers. According to Harrison's Principles of Internal Medicine, it's quite effective in treating peptic ulcers and gastroesophageal reflux disease, also known as GERD. Let's explore the indications for this medication in a bit more detail. Pantoprazole is used for a few key reasons. Gastroesophageal reflux disease, GERD. If you've ever experienced chronic heartburn or acid regurgitation, you know how uncomfortable that can be. Pantoprazole helps alleviate those symptoms effectively. Peptic ulcer disease, this is when you have ulcers in your stomach or the first part of your small intestine. Pantoprazole not only helps in treating these ulcers but also promotes healing by reducing acidity. Zollinger-Ellison syndrome, this is a bit rarer. It involves tumors that cause excessive acid production, and pantoprazole plays a crucial role in managing this condition. Prophylaxis of stress ulcers, in patients who are critically ill, pantoprazole can help prevent stress-related mucosal disease. Knowing when to use pantoprazole is really important for anyone in the medical field. Now, let's talk about how it actually works. Okay, so how does pantoprazole work? At its core, it targets the H+/K+ ATPase enzyme, which is also known as the proton pump, found in the stomach's parietal cells. This pump is responsible for the final step of gastric acid secretion. When pantoprazole comes in, it binds to this pump and effectively shuts it down. This means less acid is produced, leading to a higher pH level in the stomach. As a result, this helps reduce irritation in the stomach lining and allows ulcers to heal more effectively. In Harrison's Principles of Internal Medicine, it's noted that this action is powerful and helps in managing various acid-related disorders. Pretty cool, right? Now, let's move on to side effects and what to watch out for. Headaches, a lot of people report this. Diarrhea, this can happen but usually resolves quickly. Nausea or vomiting, some might feel a bit queasy. Abdominal pain, not uncommon, but keep an eye on it. While these side effects are generally mild, long-term use of PPIs like pantoprazole can lead to more serious issues, such as an increased risk of infections like C. difficile or bone fractures due to decreased calcium absorption. As for contraindications, it's important to avoid pantoprazole if you have a known allergy to it or any of its components. Plus, caution is advised for those with liver issues since they may need a lower dose. Understanding these side effects helps us prescribe safely. Now, let's look at how pantoprazole interacts with other drugs. Pantoprazole can interact with some medications, so it's crucial to be aware of these. Warfarin, this blood thinner, can have its effects intensified, so keep an eye on INR levels if these are used together. Clopidogrel, pantoprazole may reduce how well clopidogrel works, which is important for patients who need antiplatelet therapy. Methotrexate, if someone is on high doses of methotrexate, pantoprazole can increase the risk of toxicity. Digoxin, there's a chance of elevated digoxin levels, which can lead to toxicity. Being aware of these interactions helps ensure patient safety and effective treatment. As highlighted in Harrison's Principles of Internal Medicine, managing these interactions is key for optimal patient care. To wrap things up, pantoprazole is a powerful tool in our arsenal for treating various acid-related conditions. Understanding its indications, how it works, and what to watch out for can help us use it effectively. Thanks for tuning in to this episode of Tablet Talk. If you found this video helpful, don't forget to hit that like button and subscribe for more insights into clinical medicine. Together, let's build a smarter, stronger future.